Hiya. So what we're going to go through in today's video is hip twist again, but we're doing some different variations of hip twist. So I'm going to work Hattie through the easiest version and then progress to the more difficult version of this exercise. I'm actually going to assist her with the difficult one. We've tried it and it's probably a bit too much for her, but I just want to be able to show you guys. So again, great for riders because we're working on the corset muscles. So the obliques that are in charge of rotation and side-to-side pelvic stability, so important for our riding, whether we want to control, so we're actually asking ourselves to tilt pelvis from side to side in a controlled manner, or rotating, so changes of reins, or we're just trying to stay nice and level and nice and straight on a straight line. Simple stuff, but it's really important that we get the right muscle isolations for this, okay? So we're going to start with the easier version. The easier version is feet hip width apart, so you get yourself into your start position, which you know because we've been through it before, okay? What we do, slowly and controlled, is drop our knees over to one side. Keep your knees together, good job. And you're going to hold there. Now, as you can see, you do rotate through your spine and you do tilt the pelvis. So unlike the other exercises, we actually do move pelvis and spine. What we want to do is keep the shoulders down on the mat. We don't want to lift the shoulder away. And also from here, we can tuck the tailbone and slide the rib cage down, and it does get corsets working, okay? And we'll come over to this side now. So really slowly over, hold, tuck the tailbone, and rib cage comes down, really nice. And where do you feel this? If I let go. There. Corset? Brilliant, perfect, you're not sure. Back into your start position. Let's make it a little bit more difficult and we'll see how we get on. So that's the easier version. If I just run you through the breathing actually for that one, we take a nice deep breath in. Exhale, bring the knees over to the side. Inhale, hold, tuck the tailbone, rib cage down to the hips, feel the corset. And exhale over to the other side, all the way over towards me. Good. Inhale, hold, tuck the tailbone, rib cage down. Good. And back into your start position. You can make that more difficult actually by bringing your hands up to the ceiling. So if you just float your hands to the ceiling, that's good. So you're not able to push through your arms, and you can do exactly the same exercise, but because your hands aren't on the floor, you're really having to use the muscles to control that, okay? Stop the shoulder coming off. And over to me. And remember, tuck the tailbone. We do not want to arch the back, so really tuck that tailbone. Good, and back into your start position. So that is a slight progression of that version of the exercise. So now bring your hands back down on the floor. Cool, okay. So the next one, the more difficult version, is to come up into double tabletop, all right? Now I'm just going to hold Hattie, just because I don't want her to extend through her back and hurt her back, okay? Cool, so we're in our double tabletop. You're going to keep your shoulders down, shoulders on the floor, nice and relaxed. Good. We take a nice deep breath in. As we breathe out, we bring both legs to one side, okay? And inhale, hold, tuck the tailbone, rib cage down. Good. And exhale over to the other side. Inhale, hold, tuck the tailbone, ribs down. Really nice. And again, exhale over. Inhale, hold, tuck tailbone, ribs down. Good. And once more, exhale over, inhale, hold, tuck the tailbone, rib cage down. Tucking the tailbone, rib cage down makes a big difference in recruiting the corset muscles. You'd be surprised. Something to watch out for as you bring your knees over. Don't rotate the feet in. Exactly the same as the other one. If you start doing that, it's really easy, or it's a lot easier. Always hide your feet behind your knees. So when you're doing this, you should not be able to see your feet. Okay, if you can see your feet, you're not doing it properly. All right, hug your knees up into your chest. Have a bit of a rest. Awesome job. So guys, this exercise may not be appropriate for you. If you've got any spinal pain or anything like that, it might not be the exercise for you, and that's absolutely fine. If you're not sure, feel free to contact me via the Chaps Physio Facebook page or Instagram page, and I can answer any questions that you have. Absolutely have a go at this exercise if you want to. Film yourself, post it on social media. Remember to tag Chaps Physio, and always hashtag in your hand, Team Chaps. Thank you very much.